I would like to introduce our host for today. We have Kristen Frankham. She's the Chief Marketing Officer of BestNotes. She is here to help answer questions. So if you do have a question throughout the presentation today, I would invite you to put it into the Q&A section of the webinar. We'll try to get to as many as we can at the end of the presentation. We are honored to have Dr. Brett Talbot with us today. Dr. Talbot is the co-founder and CCO of Videra Health, the leading AI-driven mental health assessment platform. Dr. Talbot is a distinguished clinical psychologist, technology innovator, and a revered figure in the behavioral health community. He also serves as a clinical advisor to the BestNotes team. He brings his expertise in advancing behavioral health technology to our board. Prior to Videra Health, Dr. Talbot was the chief clinical officer and executive director across several prestigious healthcare organizations. His pioneering efforts led to the creation of trailblazing video based depression, anxiety, and trauma clinical assessments. And last, but certainly not least, I'm thrilled to introduce Nathan Olsen. Nathan is one of the founders and current CEO of BestNotes. Since launching BestNotes, Nathan has been dedicated to developing innovative, industry specific solutions that streamline operations, enhance patient care, and improve communication for treatment providers. With that, Nathan, I'll turn it over to you.
Thank you, Nicole. It's my pleasure today to introduce our partner, Videra Health, recognized leaders in leveraging AI to transform healthcare. Videra Health is renowned for its expansive clinical AI suite of tools, which integrates advanced artificial intelligence into everyday clinical workflows, greatly enhancing the quality of patient care. We partnered with Videra because their technology and expertise are unmatched. Founded by accomplished AI veterans and healthcare experts, Videra uniquely bridges advanced AI capabilities with real-world clinical insights. This powerful combination ensures their solutions directly address clinician pain points, streamline workflows, and meaningfully improve patient care. We decided to partner with AI experts so that we know we are bringing the very best technology to BestNotes customers. Our specific partnership centers around Videra's innovative AI notes solution, Sidekick Notes, which seamlessly integrates with BestNotes. Videra Health maintains the highest industry standards, including full HIPAA compliance, achieving SOC 2 Type 2 certification, and strict compliance with state and federal healthcare data regulations. Videra is also FDA registered as a software as a medical device. Additionally, I'd like to mention that I've been a longtime fan of Dr. Talbot. I've watched his career for many years, and I've had the opportunity to serve with him on several behavioral health research initiatives. I can personally vouch for his innovative and ethical approach to improving patient outcomes, and while having fun all along the way. Dr. Talbot and his organization are a great fit with the culture of BestNotes and our commitment to help the helper. And with that explanation of why you're here today, Brett, I'll turn the time over to you.
Thank you so much, Nathan. Thank you, Nicole, for all those kind words that I sent you to say about me. And Nathan, thank you. I have appreciated, your partnership and guidance and the partnership with BestNotes over the years, and excited to even more formally bring to BestNotes customers a AI generative notes solution. So really excited today to kind of introduce the partnership and introduce the product and how it works and give you all the background. So many of you have talked to us over the last months and years about how to bring new technology and innovative technology integrated with the EHR. So really these types of partnerships are exciting to us. And as a clinical psychologist myself, I wish I had these tools when I was in practice. And so it's really exciting and really a goal and vision come true for me to partner with BestNotes and bring these types of tools to you out on the front lines. So I'll walk through some slides and some demos. As Nicole said, we'll get to some questions at the end as well. But happy to also have any discussions in partnership with BestNotes with anyone afterwards as well. I think it'd be helpful just to understand a little bit about, Nathan mentioned the partnership with Videra Health and kind of who we are and where we come from and what makes us a good partner for BestNotes, as well as to build a tool like this. So Videra Health is the human understanding platform. We build technology and specifically AI multimodal technology to translate human behavior and expression into insights. We have algorithms that detect conditions earlier, predict and measure outcomes, and transform care. Sidekick Notes, the generative AI, is one of our tools. We have a suite of other tools, but all geared towards making your lives easier as operators, as clinicians, as providers, while not sacrificing clinical quality. So still keeping you in the driver's seat of beneficial and meaningful treatment, but having tools around you that help you do that in a more meaningful and efficient way. We do that in three main pillars of artificial intelligence: clinical AI, workflow AI, and workforce AI. Notes, the generation of notes, listening into a session and generating a draft of a note is both a clinical and a workflow and a workforce AI. So clinical AI, because it's using all of the information we know about treatment and what works in treatment to generate a good note. Workflow, because it's going to help you be more efficient in your tasks. But then also workforce, because we know it helps providers not burn out and have better experience in documenting treatment. So it kind of hits all of them to some degree. Thought it'd also be helpful just to kind of quickly touch on AI. This isn't an AI webinar. If you were at some recent conferences, I've spoken in depth about AI in behavioral healthcare. But just in terms of understanding how we generate notes, it's helpful to understand a little bit about AI. AI is a pretty broad umbrella term. I like to think about it and describe it as AI is kind of saying like transportation. It's a way of getting from A to B. But AI doesn't necessarily, as a term, say, are we talking cars, planes, trains, scooters, e-bikes? So many different ways to get to from A to B, but AI in general is trying to help use computational programming, using technology for intelligent tasks to get from A to B. I think nowadays almost everyone has had some proximity or some utility of AI. Your GPS in your car, or on your phone, ChatGPT, all these different things are using different pieces of AI. But it's more than just kind of logic, if-then statements that you might see in other computer programming. They're more intelligent tasks. Then you kind of get into what we call like generative AI. So the ChatGPTs, if you're using that in your personal life or shopping online, you're going to see some of that. The recommendations you get on your Netflix, that's all, AI in there. Then we get to machine learning. Machine learning is really then learning from the interactions you have. And the more data that we learn about a specific task, the more that the AI can improve. And this is relevant to note-taking, because we can feed tens of thousands of good examples of notes to a computer or to a model, and it learns what a good note is. It learns what good CBT sounds like in a documented note. Then there's a deeper one, which we won't get into today, which is what's called deep learning or neural networks. And this is kind of layering in lots of different types of models and machine learning to really do more complicated tasks and decision making. Notes is somewhere in between, kind of like artificial intelligence and machine learning, where we ask it to listen into a session or listen to a summary, create a note, given a bunch of examples. But as you continue to do that, the machine gets even better at understanding writing styles and what makes a good note a good note. So hopefully that kind of gives you a little bit of taste of kind of what we're talking about. We're not talking about robots that are taking over the world. We're not talking about self-driving cars. We're talking about things that you already are taught to learn for, listen for, look for, and document. And we've taken so many of those examples, fed it to a computer and said, hey, if you listen to a conversation, write a note like these. And so it's really just an outcome of all of the clinicians in the world's work in being able to generate these types of notes. So with kind of that background in AI, and we know that automating these tasks can help keep it more consistent and more objective. We've built things from automated intakes to post-discharge monitoring to progress monitoring, automated screening, assessment, and monitoring tools. And we said, hey, this is a really good use case to build a notes solution. And we know that clinicians can spend up to 1/3 of their day. Now, some of you seasoned professionals may get really good at writing notes and can do them quicker. We have a lot of new therapists out there, a lot of new clinicians out there that are still learning to write notes. And then even as a clinician myself, I would do pretty good for a little bit. I'd have a little extra time, write really good notes. But if I had a long week and I'm like towards the end of the week or nights or weekends, I'm not putting as much effort into my notes. So we know that it's a big mental load and a big burden to the level of documentation that you're expected to do nowadays. So we're spending a lot of time writing notes. And so we wanted to build a tool that's helpful for that. We know that 62% of clinicians are already using notes, a notes tool, or interested in using a notes tool. So it's definitely one of the, call it, easy ways to dip your toe into using AI in a clinical setting. It's important to know the difference between a clinical AI and just call it consumer AI. So you may use AI out in your normal life. That's not as regulated, to be honest, as is healthcare AI. So Nathan mentioned HIPAA compliance and cybersecurity and privacy and security are all paramount in using AI within a healthcare setting. But it also keeps you as the clinician or as the provider in the driver's seat. This type of AI is not forcing you to make any decisions you don't want to make. Think of it as more of like a draft. It's a draft of a note for you or a draft of an idea, but clinical judgment and clinical decision-making remains in your hands. So that's why we see kind of a quick adoption of these types of tools. And in the end, you don't want to use it, you can write a note as you always have, either just typing it in. And I worked with a few psychiatrists that were still just handwriting notes and somebody would have to type it in for them later. By all means, all of that's still available. But again, for those who want to use tools, be more efficient and consistent, these are good tools to use. And by doing so, it saves you time. 78% of clinicians have used note-taking tools report saving documentation, and 96% find them easy to use. And you'll see that a little bit later, how easy they are to use. Of that 78%, the people who didn't save time, I venture to think that they have very particular ways of doing notes, and so this is, again, generally giving you a good starting place. And then you'll have opportunity to kind of finesse a note to how you want it to be. And then the system learns kind of your style and learns how to improve those notes in the future for you. Some of the key benefits of having an AI automated note generator again, is time efficiency. Spending a lot of time, this will make it quicker. Doesn't eliminate it, but does make that a more efficient task for you. Should improve job satisfaction. We get a lot of feedback that, okay, it helps me get through the day, help me get through the week. You got into healthcare because you wanted to, and behavioral healthcare and therapy, to treat patients, interact with patients, not to document. That's what we all kind of got through grad school or advanced training, and we're like, oh, we're going to spend a lot of our time just doing paperwork. So hopefully it improves job satisfaction as you have tools to help you combat burnout, improve your experience and being able to focus on client and patient care rather than just documentation. Could enhance patient interaction as well. So during a session, you can be more focused on the conversation and the interaction in the session rather than jotting down notes so that you can remember them later. Again, feel free to continue to do that, but hopefully now that you have the opportunity to have a tool being listening in and being able to summarize and generate a note on your behalf, you can stay more focused during a session. And lastly, just clinical impact. Having these types of notes, it means that you don't have some of the inconsistency on using clinical words or jargon. Have more sophisticated and high quality notes, regardless of if you're a seasoned therapist, a new therapist, you have a little bit of time, a lot of bit of time. These types of notes can improve accuracy and the quality of the notes over time, and compliance, so we can make sure that notes are getting done on time and being done comprehensively enough that you're not getting yellow flags and red flags in compliance for lack of meaningful notes. So all of that, I would imagine all of you can attest to some of these things, is why having a solution like this is helpful. We call it Sidekick Notes, and we call it Sidekick because you out there on the front line doing the work, working with the clients, doing the therapy, doing the treatment teams, the groups, the sessions, working with, doing the hard work, you're the superheroes. You're the ones out there making an impact in people's lives. You're the superhero, but every superhero needs a sidekick. Every superhero needs a helper, needs something and tools to kind of help get through the task at hand. So that's what we built for Sidekick Notes, a clinical AI session note generator built into the BestNotes EHR. At a high level, I'm going to just highlight a few things that it does, and then we'll kind of get into a demo and what that actually looks like. So there's two ways, primary ways to use it. There's an ambient listening pathway as well as a dictation pathway. An ambient listening pathway is basically turning on a microphone and it will listen into the session. At the end of the session, generate a draft of a note. The other pathway is dictation. So if you didn't record or use the ambient listening tool to listen in for various reasons, you forgot to press record, the patient doesn't give consent, or various reasons, you can actually just open up the microphone and dictate a summary of how the session went, and then it will still generate a note. So ambient listening and dictation. And that will generate a SOAP note, a DAP note, a GURP note, many other different types of formats of notes. So again, you can kind of just decide your format. You can also change the note style. So typically in mental and behavioral healthcare, we're using a style called a progress note or a progress update, which is a little bit more what happened in the session, what's going well, how is the person continuing to get better, identifying plans to address gaps. So that's a typical note. You can also change it to what's called a medical necessity note, which is a little bit less narrative, a little bit less focused on what's going well, a little bit more focused on clinical criteria, diagnostic criteria, clinical jargon, something you might send to, let's say, an insurance company or for a utilization review or something to that effect. So you can actually change the style of the note as well. You can add commentary later after the note is generated and you missed something, let's say a nonverbal in the session, you can actually walk through that as well. Supports English and Spanish, and again, seamlessly integrates into BestNotes. So those are the highlights. I'll show you what that looks like. A couple of add-on features that just wanted to mention. There is what's called Sidekick Insights, which is an interaction analysis. So the system is already listened into a session to generate a note. You can also generate a feedback report back to the provider. So it's something like how well they did at building rapport, building trust, and showing empathy during the session, an analysis of emotions, lots of different things, but just an analysis of how the session went. We also have a Zoom integration as well if you're doing telehealth. So let us know if those are of interest. At its core, it's this ambient or dictation listening, generate a different style of note, and you're able to interact with that note until you're ready to finalize it, and then it's automatically put into the BestNotes system. So I'll show you what that looks like here, but just wanted to highlight, again, these are tools and solutions to help you as the superheroes. So kind of getting into it, I'm going to show you how Sidekick Notes works inside BestNotes. I'm going to show you in two environments. First, I'll show you in BestNotes Fresh, the newest edition of BestNotes, as well as BestNotes, the current edition of the electronic health record. So I'll show you how it works in both. So first here is what it looks like in BestNotes Fresh. Let me go ahead and show you what this looks like. So I'm signing into Fresh. I'm searching for a client. I chose Nathan to be my client here. I'm adding an activity, starting a new individual therapy note. Pulls up the progress note template. And then you'll see here over at the side, there's a little icon over here at the side, and clicking on that will actually open up Sidekick inside BestNotes. Now I'm going to show you what it looks like to do the ambient listening. So this is, you're about to start a session with a client, and you're about to bring them into the room. You'd come in here, navigate through what I just showed you, and then you would start Sidekick from inside BestNotes. Once you start Sidekick, the first time you do, it's gonna walk you through a few things. One is gonna ask you what kind of note format you want. If we implement this at an organizational level, we can make that a default setting, and BestNotes can help you make that a default setting to a DAP note or SOAP note. We've chosen DAP note for this demo, as well as choosing between default for a progress update or medical necessity. You can change this later in the process as well. And then here's where you have the two different options. You have start recording a live session. And so that's where you're going to bring the patient or client into the room and have a session. It's listening into the session. Or you can start the recorded dictation. So this is when the patient or client's not in the room. Maybe the session's already done, and you're just going to open up that recording and give a 2 to 3 minute summary of what happened in the session. And then Sidekick will help you generate a note based off of just your summary. In this particular demo, clicked record a live session. I'm not going to make you listen to an entire live session. So we've kind of cut the middle of that, the piece out of this recording here, but you pick your microphone and you start the session recording. Now, if you have not received consent to do this, there's some instructions on how to do that in the session, but typically we see people include a sentence or two in your treatment consent forms, or when people sign up for outpatient care or inpatient care, just putting some of these, some language into your normal consent process. If you haven't done that, then this gives you some instructions on how to get consent from the patient on the recording prior to continuing. So it gives you some instructions there. But assuming that you've either gotten consent in your own paperwork or consent here as part of the recording, then you can click continue recording. And then what happens is it's going to pull up a tab in your browser window. And and it's going to be recording in the background. So then again, you just open this up on your computer and microphone that you have in the room. You don't need any special equipment. You're just using your normal setup. And then you just do the session as normal. You'll be able to see that this little microphone is moving, so you can tell that it's picking up what you're saying. We encourage you to do a couple test sessions too as well. Just make sure your microphone and everything's working well. But once you're done, you can just press end session. And that's about how long it takes to create a note. So you can see here that it's created a DAP note. In this particular very short fake session that I did here, a lot going well for this individual in terms of mood, but also having some sleep struggles. So it was actually a very short kind of fake session that I put in there, and it made a really decent note around it. In the format. Now, you can do a couple things. So let's just say I wanted to change my format. So this is where you can do that, or change the tone or the style of the note. You can do that as well. But because this is an ambient listening and it's just listening into the audio, Sidekick doesn't know what this person looks like or what may be happening non-verbally in the session. So that's not going to be picked up in the note necessarily. So you can go in and do what's called add a commentary or add a note and regenerate. So if you do that, you can come in here and you can add a dictation to note. What that means is I'm going to just start a recording here and say, actually, during this session, Nathan arrived very disheveled, his personal hygiene was poor, looked like he hadn't showered in a week. Can you weave that into the story? And not the true case for Nathan. Can you weave that into the story or into the note and then regenerate the note? And you can do that dictation commentary as many times as you want as you think about other things that you might want to add into the note, and then regenerate it. Takes a few seconds and you can kind of see that now it's regenerated, and you can see that it's patient's appearance indicated need to address personal hygiene, which may reflect underlying issues that are not fully resolved. It puts it into each piece, the data, the assessment, as well as it made a plan to set treatment goals to improve personal hygiene. So that's an option for you to kind of continue to make the note what you want without having to, type. However, if you wanted to type something or edit the note directly, you can just go in directly and edit any portion that you'd like. Again, what this is trying to do is give you a really good place to start, but does not force you to put anything in the medical record that you're not comfortable with. It is generative AI. It is trying to make its best assumptions and best guesses around how you might write your note based on what happened in the session or in the summary. So we always encourage you to go through and make sure you're comfortable with it, and make any changes, save those changes. And then when you're ready to do that, you go over here, back over to BestNotes, and you can see that it's automatically already right in there in BestNotes. And then with a quick few clicks of a button, you can choose to then inject that into the note. So you can see that happening here. So it's injected that into the progress note in the data, assessment, and plan portions of the note. And if you want to ever go back to see previous notes, then you can see all of that here as well. So it kind of keeps a history as well. Again, BestNotes is your medical, your system of record. What's being stored here in your notes portal is just kind of your drafts and how you've interacted with previous notes. It's not the medical record itself. All of that's being stored in BestNotes. But if at a later time you did a progress note, let's say, injected that into the progress or the progress update and put that into the progress note in BestNotes, and a week or two later you wanted to come back and maybe use that same session to create a medical necessity note that you're going to send that you're going to aggregate for a utilization review or send to an insurance company, you can come back here and regenerate those notes as well. So it's really just giving you all of your notes and recordings and stuff at your fingertips in order to interact with them as you would like, and then get them into BestNotes seamlessly. So that's what that looks like in the newest edition of BestNotes. What that looks like is very similar in the current edition of BestNotes. So you'll see here, if this is the version you're using, a very similar sidebar. I don't have a recording here. Didn't think it would be necessary to make you watch two different recordings of functionally doing the same thing. But it's a sidebar here to launch Sidekick within BestNotes. Once you have the progress note open, you follow that same process of choosing your defaults, the note type, recording or dictation, get into your notes portal, interact with the note once it's ready to go. Very similarly, you'll have that show up here within BestNotes, and then use these buttons to inject them right into the progress note. Now, you may think, well, can it just go straight in? And yes, of course, technologically, we can have it feed or appear right into a note. The FDA at the federal level right now does require and does recommend that there is a physical decision from a provider, you, to inject that into the medical record. So it's going to sit there right on the side, but you make the choice of what you're putting into the patient's record. So again, you're fully in control of what goes in there, and you can edit as much as you want before injecting it. If you don't like any of it, then you write your note as normal, but we don't find that happening very often. We find that this gets pretty close to how people want to document their session. So that's kind of how it looks in both environments within BestNotes. If you are already so just a clarification as well, if you're already a Videra Health user, and so you have a Videra Health account, we're using some of our other tools, whether that's our Videra Assess screening, monitoring, and assessment platform, or our intake manager or our HR tool. If you already have an account, please just let BestNotes or us know so that we don't create you two accounts, one for notes and one for your other Videra tool. We can just activate Sidekick within BestNotes for your current Videra Health account. So please let us know that if you're interested. It is very simple to use. Hopefully, I quoted that 96% people find it easy to use. Hopefully you saw that. Hopefully you saw that just with a couple start recordings, end recordings, and some interactions, how easy it is to take what's happening in a session or your own words in a summary and generate a really quality note for you to use. In general, we're just trying to simplify documentation without losing clinical quality, because that's what we've done historically. Trying to simplify it meant just shorter or less information, and we don't want to sacrifice documenting really clinically what happened in a session just to make it simpler. So using AI and automation like this really does help you accomplish that goal. And we want to do that from within your EHR. We don't want to make you do that separately or go into multiple systems. So that's how why we're really excited about this partnership. There are different tools out there. We know that you've probably been inundated on different tools that you could use. As we've built this out and as we've partnered with BestNotes, I think you get some value out of using it from within your EHR. One, because it's integrated with your EHR and you don't have to figure out some other system. But we've also, because we have such a good partnership with BestNotes, really enabled most, if not all, of the functionality that you would maybe have to pay premiums for on these other standalone tools. So from the note generation to the style to the ambient listening versus the dictation, things of that sort, and storing history, all of that's available for you with this BestNotes and Videra partnership for very reasonable price compared to all the other options out there on the market. They're typically charging $100 or more per user per month for less functionality. So we're excited to bring a full suite of functionality for you for only $49 a month per user. We're actually also doing a trial during the month of April. So beginning April 1st, you'll be able to sign up directly from your BestNotes account. So you'll log in, you'll have some instructions there on how to sign up and enroll for Sidekick inside BestNotes. All of this functionality will be available. During April, it's a free trial, and then for only $49 a month, all of this is available to you, and we'll be growing and adding features as we go as well. And we hope that as we continue to get feedback from you on what you want and what would be helpful, that we'll continue to grow that functionality. So excited to, for us, Videra as kind of powering this and building these tools. Our goal is to get these tools into your hands and used as much as possible. So, there's no charge for how many notes you do in a month or how often you use it. Just we want you to use it as much as possible, and we'll grow with other additional features as they become available and as you provide feedback as well. A little teaser that way into what's coming is we do have group therapy launching soon. This will be as far as we know, the first AI note generating tool specific for mental health and behavioral health, launching a group therapy solution. We've been able to, through pilot and beta testing, really get good at understanding or recognizing speaker recognition in a group. And it will have like a general group note and then individual notes per speaker as well. So exactly how you likely are already documenting group therapy, but in a very similar automated way, both for dictation as well as ambient listening. Family therapy, very similar. For those who are in inpatient or residential settings, being able to use the dictation feature for a residential note. So obviously it's not going to ambient listening into an 8-hour shift, but at the end of a shift, if a shift supervisor opens up a microphone, explains what happened in a shift note or in a shift, we've already been training a machine learning model on thousands of examples of good shift notes and bad shift notes, and how to generate a good shift note. Psychiatric notes for those who have prescribing providers involved in the treatment regimen, and also coming soon is treatment team meeting notes. So again, those who are having multidisciplinary treatment teams listening into a treatment team meeting and auto-generating a summary and a Gen AI treatment team note. So lots of exciting stuff, but beginning April 1st, your individual session Sidekick note generator will be available from within BestNotes. Free trial during April. And then more to come as you see here. So we're really excited. We've had a lot of good feedback since we've launched this, and happy to bring it to BestNotes customers in a seamless way. I know you might all have lots of questions. I know we have some time to get to some of them, and so I'll turn it back over to you, Nicole, to see what people have to say. Thank you, everyone, for participating thus far.
Thanks, Brett. That was great. Just a reminder, everyone, I will send out a recording of this webinar if you need to share it with your staff, and we'll also include pricing information and how to get started as well, beginning April 1st. One of the first questions that we had, Brett, is this 42 CFR Part 2 compliant as well?
Yeah, so it does comply with all of the standards for HIPAA compliance, Part 2 for the substance abuse treatment programs. If you're in any other treatment setting as well, much of our core platform is being used in clinical trials at the highest level of regulation. So yes, Part 2 is included as well.
And on that note, compliant with state entities, regulations.
Yeah, we do try to keep pretty up to date with what are going on at the federal and state level because our core platform as a whole is registered as a software as a medical device with the FDA. We do also have to adhere to those standards. Each state is in varying degrees of making their own rules around AI. Myself, I just finished sitting on the stakeholder advisory board for the Office of AI Policy in the state of Utah, and we just drafted language that's going through legislation now around how to regulate AI in behavioral health. So we try to keep up on that. So as of right now, we haven't heard any state that would that is regulating using AI for note generation within a mental or behavioral health setting. If you're hearing something different in any of your local or state or regional levels, then please let us know and we're happy to look into it. But we haven't heard anything so far, and we're at it, across the country being used. So.
Brett. So how do you delete the audio recordings?
Yeah, so if you want to go back into that note history and be able to interact, it does store the recording in a, again, HIPAA compliant and cyber secure way so that it can kind of regenerate. Each time you want to interact with it, it'll go back to the original recording and be like, okay, how would I summarize it if I were to change it this way? You do have the option to let us know if you'd like to delete any particular recording, or if there's some policy that you want that to be deleted regularly, then we can set that up on the back end. So let's just say you have an internal policy that you don't store that type of stuff. So you would just, the system would record a session, generate the note, and then dump the recording. Now there's pros and cons to that, right? Because now you can't ever go back and interact with that note to regenerate it. But yeah, we can, there's options there as well based on your agency's policies.
Were you able to change format from a progress note to a medical necessity later on for insurance companies or a group of previous note?
Yeah, again, assuming that you've kept that history there, then you can go back later and change the format and the style of the note. Yeah, and we'll have other things coming that will increase the types of ways to interact with the note.
We're getting some questions on how the model was trained for interaction analysis.
Yeah, let's see. So the interaction analysis, that Sidekick Insights, I'll answer that in brief. Whoever asked that, reach out to me directly. We can have a deeper conversation about it. But basically, very similar to any of our AI and machine learning models, where we took examples of sessions, and we have research partners and development partners who have recorded sessions of therapy, and then we take that and feed it into our models and train it over time. So each AI model has a large sample size. It's been trained for bias and trained towards what we call endpoints or targets, and tuned for, is it measuring what we intended to measure? Just like any other, call it like screener assessment tool that you might use, or questionnaire. Does the PHQ-9 measure depression? There is a whole validation process for that. We go through a very similar, if not even more rigorous way to validate each model of, is it picking up on emotions correctly? Is it picking up on nonverbals and verbals correctly? How does that change for region or for culture or for ethnicity, for age? All of those things have been tested as well. But good question. On insight specifically, reach out to me. We'll have a deeper dive.
Awesome. What about can it write in the way that reflects like a therapist's personal voice? Will it study previous notes that have been written so it writes in the similar style?
Yeah, we are in the process of potentially adding a place where you can go in and give it some instructions and or examples of your specific style. We don't that won't be available starting April 1st, but that's some feedback we've recently gotten as well. So we're working towards how to almost train the AI to reflect your personal style more, and then as you make changes within the notes, it'll use that. Oh, Nicole always changes this type of sentence, and so it will learn that over time. Today, it is still learning that in the general model, but not specifically for you, and we're working towards that.
Great. What about like play therapy sessions with younger children? Have you found any differences with that?
Yeah, there's going to be some nuances. So if you're doing something that's much more kinesthetic, again, this is ambient listening audio only, on the ambient listening side. So there's some, you may not go do equine therapy and try to ambient listen into this. So there's some nuances to the modality that you're using, but for any talk therapy, regardless of your theoretical orientation, it works great. Be mindful if you're doing other types of therapy and how it and how it may or may not be the ambient listening portion of it be a good option, but always the dictation is a good option. If you're coming in and doing even just like a 30-second summary of what happened in the session, it will write you a decent note as if it had listened into an entire session, but kind of depends on how much detail you give it in the dictation.
Awesome. But what about when clients are using a lot of slang? How does it
Yeah.
decipher that?
Yeah, it does really well at taking what we call kind of just normal conversational context and language and translating that into a clinical note. So it's not just doing a summary of what was said in the session, right? It is translating that into a clinical document and clinical documentation. So it does really well with picking up on nuances. Of course, I have a teenager in my house, and she comes back with some slang. I don't know what it means. I don't know if AI knows what it means. I don't even know if she knows what it means. So of course, there's going to be edge cases where they use a word that the AI may not know what it means. But in general, it does a really good job at capturing things in context and giving an overview of what was potentially intended to mean by that. But yeah, it probably won't know what skivity means.
Are there plans to add integrations with Microsoft Team meetings?
So we've had requests to do things beyond Zoom, including Meet and Teams. They are on our radar, scoping them. Of course, Microsoft has their own notes tool, so it takes two to tango on some of those things. We're good partners with Zoom, but some of the other things like Microsoft, it takes a little bit of time to navigate around if they're willing to partner with other tools like us. So, but on our radar, and we're working towards it.
A group therapy session, Brett, is it able to distinguish between different participants in the group therapy session?
Yes. So in again, this is being launched soon, but in our beta tests and pilot tests, it is doing a good job at identifying the speakers, especially if you've had them in group before or on a recording before. So if you're using like our Videra Assess tool and they've done a video assessment, so we know what Nathan looks like and sounds like, the system will be able to recognize when he shows up in a group, and also when he's speaking inside that group. If it's a group of people that we don't know who it is, then the system will guide you through and say, hey, speaker one, this is everything that speaker one said, but can you tell me, can you assign speaker one to an actual participant? We'll assign speaker one to Nicole, and then the system will be like, oh, okay, this is what Nicole sounds like. Next time in group, it'll be like, oh, that was Nicole. So it does a really good job at that, but sometimes needs a little bit of help if the system doesn't know who's in the room. But once you assign a speaker to a profile, then it does a good job at recognizing that in the future.
Great. Brett, could you speak more on using it with a mobile device and specifically while using the BestNotes mobile app as well?
So we do have, so if you're using a microphone in your room, that's the best way to do it now. We are working towards having kind of call it a mobile application, so you can use a microphone on a different device. I don't know, Nathan, we'd have to check to see if your dev team is, I'm not
we have
familiar
not
with
done
that.
any integration yet with the mobile app.
Okay. But similarly, something that we have in development as well. So I'm sure we can figure out a way to make that work with BestNotes as well.
And will regular laptop microphones be sufficient for the
Yeah.
system, or?
Yeah, typically whatever system you're using, as long as it's not extremely old, should be sufficient. Go ahead and test it out, but we haven't found anything that's you don't have to have a professional microphone or some, podcast microphone or anything. Just whatever you're typically using should work, as long as it's within a decent distance that it can pick up on the audio. But something you want to test to be sure.
Can you do both a note and get feedback at the same time?
Yes.
We've had a lot of questions, so we're just, some may have been at the beginning of the demonstration
Yeah,
versus
no
now,
worries.
so we're trying to keep up. We really appreciate everyone being so engaged. In the future, do you think there'll be a feature for possible diagnosis or differential diagnosis due to
Differential
symptoms
diagnosis.
recognized with AI during the visit?
Yes, so I didn't have time to put it in here, but we do have on our roadmap that embedded assessments will be available as well over time. So if it's listening into a session, it can actually estimate what somebody's PHQ-9 or GAD-7 score would be based on the conversation, and then we can map that onto clinical criteria, as well as then give recommendations to treatment regimens. So yes, technologically all in the future. Obviously, as our partnership with BestNotes continues to grow, what that looks like in the future for the integration will be known, but technologically, that is something we are actively working
Awesome. Are the notes accepted in court?
on. Are the notes accepted in court? Probably some context to that question that I don't have, but let me just take my best guess. Remember, the AI-generated note is just a draft of a note. You still have complete control of what actually goes into the medical record. What goes into the medical record will follow your local and state rules around what's discoverable in a subpoena or in a court setting. So that's going to differ per a lot of different regulations. But generally speaking, what's in the medical record and is part of the designated record set, those are discoverable in court. And even if, even if you used generative AI to suggest a starting point for your note, whatever you put into the record is your note. You signed it, you locked it and signed it. So again, we always encourage you to make sure to read through the note, make sure it's what you would want. And the Gen AI is just helping you get there faster, getting you 80–90% of the way. You make a few edits, but it still has to be what you want in the record.
If the provider doesn't have time to incorporate the notes into the client file right after the session, what are their options?
Yeah, you can actually just save it. So it'll generate and you just save it in your notes profile history, and you can go back at a later date and get it into the into the note on BestNotes. So that happens if you're like already running late on a session, you're over, you have somebody else in the waiting room. You can just end the recording and immediately start another recording. You don't have to go do the interaction and the injection into the note. You can do that all at a later time.
Great. And are there additional note types available? For example, case management notes?
We are constantly building new note types. Case management notes are interesting because everyone has a slightly different style, where DAP and GURP and SOAP are fairly similar, but please let us know what you're using it and what the format looks like and what the volume looks like. If we have some good examples of what a good case management note in your format looks like, it's pretty easy to start adding new format types. So just let us know and we'll see what we can do.
And on that same vein, what about for supervision notes?
Yeah, supervision notes. We do have a tool called Videra Supervision. So it does use a portion of kind of what that insights interaction analysis looks like. A whole nother rabbit hole we don't have time to go down today. Reach out and we can discuss.
Great. We've talked about group notes. What about nursing and medical notes?
Yeah, psychiatric notes are on the roadmap. Nursing notes, I would say, are on the radar. We haven't had a ton of requests for it yet. So if that is something of interest, this is why we like, again, a partnership with BestNotes. Is if enough BestNotes users and customers want a specific thing, then Nathan and I get in a room and decide what's priority, and we're happy to collaborate on BestNotes customer needs.
We have still a ton of questions to get through. I and my colleagues will go through all these questions and see if we can put an information sheet together and try to get all of your questions answered. But if anyone wants to reach out to you directly, Brett, where can they do that?
Yep. You can reach out to me at brett@viderahealth.com. You can reach out to our website or our generic email shown here, and happy to discuss. But brett@viderahealth.com is fine.
That's wonderful. Well, thank you so much for your time today. I will send out a recording again, and I will also include all the pricing and how to get started with Videra. Nathan, is there anything else that you would like to end our webinar with?
Thank you, Nicole, and thank you, Brett. That was a great presentation. We're so lucky to be partners with Videra. Really looking forward to all of the features that are coming down the line, but there's already one in play that's extremely helpful, and really look forward to getting feedback from all of you on your usage in April. Again, it's going to be April 1st before this will be active in your BestNotes account. A system administrator will be able to activate it from within your BestNotes account beginning April 1st. Again, no charge for April. If you're still users in May, then that would be the $49 per month per user. So you'll want to keep an eye on that as the end of the month comes. We'll send out reminders on that too. Thank you.
Awesome. Thanks, everyone. Enjoy the rest of your day.
Thanks, everyone. Take care.